Good day. My name is Duane Praschan. I'm a resident at Township Senior Living in Springfield, Missouri. And I'm coming and sharing with you my perspective on the new vaccine that is coming out. My wife and I, we live together here, and we are planning as soon as it's available to do the vaccine. And you may be asking why. Uh, I have a doctorate degree. I teach at the university. I still teach at the university part-time. I formerly worked with FDA. And so my whole life experience influences how I look at it. I'm also a pastor. I teach Bible studies and this type of thing. And so I bring all this perspective to the decisions that I make in my life. And so, yes, my wife and I are going to be doing it. And the reason for it is because while I may not directly concerned about what may happen to me because I'm relatively healthy, I'm here because of my wife's health. And so to protect my wife, because I love her greatly and those around me, I do not want to be a carrier. And so if I know there's a way of solving that issue, I'm going to take advantage of that. And so that is the reason, yes, to protect myself, but more to protect my wife and those around me, my family that live in the area here. In terms of the safety of it, because I think that's an issue a lot of people have. As I said, my background is I'm a doctorate, but I also worked for a company called Philips. It's a global company, and worked in the MRI division. And so I've dealt with FDA all the time for brand new technology that was being introduced. And I saw how FDA works. And in the pharmaceuticals, which is where these vaccines are coming from, it's even more onerous in terms of the amount of testing that is done. Some people have said, well, why? How has this moved so fast? And that's because the pharmaceuticals actually have been working relating to the types of viruses that the COVID is actually for over 10 years. And so they were far along. And then obviously when the virus actually hit the way it did, they put it into hyper speed, and they were able to acquire tens of thousands of people who are willing to go through the testing process to ensure that the product was safe. So when I go and get that shot, whenever that happens in the next several weeks, my confidence is very high that not only will it be safe, because that's the primary role that FDA has to ensure that we have safe, just like we have flu vaccines, just like we have vaccines for measles and other vaccines. All of them are there because they have been demonstrated through clinical trials that it is safe. Not only that, FDA's other point is that they have to ensure that it is effective. It does what it's supposed to do. And so when they enrolled these tens of thousands of people for this study, it demonstrated to them that not only was it safe, there were a few people that had some side effects, just like almost any drug out there has some side effects. It is such a small percentage that it becomes little footnotes at the bottom of the instructions for use, that 99.999% are going to have at most some mild, they might be stiffness in the arm, they may feel a little nauseous or something like that, but they're going to quickly recover from it. And unfortunately, social media highlights those few cases that are problematic, and they're problematic not because of the vaccine, but because of possibly something else that's going on in their bodies. The last thing I want to share with you before I close today is looking at it from a religious point of view. Is I believe that God cares about all of us, and he cares about our health. And so I thank God that he's given people the ability to help us learn about our bodies and how they work, and help us deal with diseases that were rampant in the past, so that they're not the problem like they in our society today. Obviously, there's still diseases that are out there. And so I'm grateful for those that help us understand how we can protect ourselves. And so if I go and get this shot, this isn't a mark of the beast. If that was the case, getting a flu shot would be the mark of the beast, or getting a shot for measles, getting any of the shots, because they're just there to strengthen our bodies, strengthen our immune systems, so we can deal with the viruses that are out there in our world and which we live. And so I go with great confidence that it will work, that I will stay safe, that my wife will be safe, and ultimately that we as a society will get back to some level or normalcy, because I believe this is the right thing to do. And I think in a way this would be pleasing to God, because God doesn't want us to unnecessarily expose ourselves to risk and then say, oh God, you got to protect me, when God says, I've given you the tools to protect yourself, use them. And so that's what I'm going to be doing in the next few weeks when the virus becomes available. I trust this has been helpful, and I trust you have a great day. God bless.